we have people coming back on and joining us. So I'm going to go ahead and introduce our next presenter. And I want to just, before I do that, just mention that this is a really important topic that we're going to be discussing. And it's one that we get probably more questions about from young women with lupus than anything else. You know, concerns about pregnancy, getting pregnant, having a successful pregnancy, taking medications. A lot of young women ask us about birth control and concerns about that. So this is a really important topic. And so we're glad that Dr. Catherine Sims can join us today. She is a rheumatologist at Duke University, and she is working under the mentorship of reproductive rheumatologist, Dr. Megan Klaus. I know she's got some really great resources as well. So I'm going to turn this over to Catherine. You should be able to share your screen. And you can ask questions during or after, and we will try to get answer as many questions as possible. So I'll turn it over to you, Catherine.
Thank you. Can you see my slides okay? Okay, perfect. I just want to thank everybody for allowing me to be here today and organizing this event. This is a very important topic, and I work in a weekly clinic where we counsel women on pregnancy and birth control, and we also work with maternal fetal medicine, which are high-risk obstetricians and other specialists to properly manage pregnancies in women with lupus. I want to let everybody know that during this talk, I'm not going to be discouraging you from pregnancy. I think that's a really big source of anxiety for people with lupus, that pregnancy is really important to them, and having a family and having children is very important and part of their own personal goals. And I think people get anxious when they hear talks like this, that I'm just going to be continually listing reasons for you not to get pregnant. And that's not the case at all. We see a lot of women who come to us in tears that said, you know, I was told I was never allowed to get pregnant, or I couldn't have children. And the reality is that most women with lupus can have very successful pregnancies. And so if you want to have children, then my goal today is to give you the tools in order to make the best decisions to minimize risks and complications in your pregnancy. And that will make for a healthy mom, which increases the chances for a healthy baby. So please know that this talk is not going to be discouraging, but will just empower you to make the decisions that are right for you. So we're going to review a lot of different phases of reproduction. So we're going to start off with the prevention of pregnancy, birth control. We're going to talk about emergency contraception. So what do you do when your original plan of birth control fails? And then what if you want to get pregnant? What if you're kind of in that phase in your life where you are thinking about it, you're contemplating it, and you want to know what the steps are that you should take in order to make that happen? We'll also discuss breastfeeding, unplanned pregnancies, infertility, and menopause. And I know that menopause is a little bit beyond the scope of the women who are here today, but it is a phase of reproduction that all women will go through. And so you will eventually have questions about this. So it is important to know what the data shows right now about if it's safe or not to treat you with specific medications during menopause. And lastly, I will touch on COVID vaccinations. So this topic is very important because, like I said before, I want to empower you to make informed decisions about living the life that you want to live. That's the overall goal of this talk. So a lot of the talk, I'm going to be referencing this handout, and this is a handout that can be found at lupuspregnancy.org. It was created in order to summarize all of the recommendations from experts. One side is on birth control and the other side is on planning your pregnancy. So let's first tackle birth control. If you are sexually active, you should have a birth control plan. I think that should go for any woman, but especially in women with lupus, it's really important that the timing of your pregnancy occurs when your lupus is very well controlled and quiet, and while you're on medications that are compatible with pregnancy and breastfeeding. And we'll get into all those details a little bit later. But the way that you can minimize complications is to have appropriate birth control so that you don't have an accidental pregnancy, which can pose risks to your health as well as your child's health. And it's very important to understand that not all birth control is created equal. So we're going to go through the different levels of effectiveness of different birth controls, meaning that like condoms are not as effective as IUDs. Those are two completely different types of birth control, and they work very differently. And one works really well and one doesn't work very well. It's really important that you talk to your rheumatologist about your level of lupus activity and your risk of blood clots, because this can change the options that you have for birth control. So some women with really, really active lupus, you can be higher risk for birth control. On the right here, you'll see that sometimes certain level of protein in the urine can make you higher risk for blood clots. Certain autoantibodies that we test for in the blood can make you higher risk. Or if you've had a history of blood clots, sometimes women get blood clots in their legs or they get them in their lungs. And that means that you're at higher risk for more blood clots in the future. And so there's certain birth controls that we would like to avoid. But the good news is that there's just as effective birth control without any risk to you when it comes to blood clots. So this doesn't prevent you from getting birth control. It just limits some of the options that you have, but you will still have just as effective birth control as somebody who's not at risk for blood clots. This is important because if your lupus is super, super active and you're high risk for blood clots, and we give you a birth control that has estrogen in it, which is a hormone that can increase your chances, then that could create more complications for you, which could delay the pregnancy that you're hoping to have, and could create more medical complications for you. So that's why it's just really important to know from your rheumatologist, hey, what's my risk for blood clots and how active is my lupus? So this is where we're going to start talking about the different levels of effectiveness when it comes to birth control. Tubal ligation, also known as getting your tubes tied, is an option for women who have decided that future pregnancies are not part of their personal goals. I have seen women get their tubal ligations reversed and have pregnancies after that, but that's an additional procedure, definitely higher risk for complications. And so I really caution women that if you are thinking about a possible future pregnancy, that there's long-acting reversible birth control that are just as effective as tubal ligation, but can be reversed and wouldn't make you have an additional surgical procedure, which has its own risks associated with it. So the two types of birth control that we deem the most effective, aside from surgically having your tubes tied, is an IUD, which is also known as an intrauterine device, which is, you can see a picture of it down here. It's kind of T-shaped and it sits in the uterus itself. The uterus is kind of shaped like a dome. And so this IUD, this T-shaped IUD sits at the top of the uterus. And there's different types. There's hormonal IUDs, there are copper IUDs. They all can last for different periods of time, between 3 and 10 years. And some women are like, I don't want any hormones at all, so I'm going to do the copper IUD, which is great because the copper IUD works just as well as the hormonal IUD. So it's specific for each woman what they want to do, but just know that IUDs are super effective. But some women don't like the idea of having an IUD placed. It kind of makes them nervous, or, they had a friend who had one and she had cramping or she didn't like it. And so there is something called a Nexplanon, which is about the size of a matchstick. And it's done in the clinic. You don't have to go to the OR. And IUDs are also placed in the clinic, I should say. You don't have to go to an operating room. These are very routine procedures that obstetricians and gynecologists do in their clinic. But the Nexplanon is about a matchstick size, and it goes underneath. You have these muscles in your arms where your bicep is, and right in between that, underneath the bicep, they'll place the Nexplanon. And after they place it, you'll be able to feel it. You can run your finger over it. It won't move. It's lodged in between the muscles, but you can feel it underneath the skin. And it's just as effective as an intrauterine device or an IUD. It's just as effective as having your tubes tied. So these are two really great options, because if you're like, okay, I want to get pregnant now, they can just take out the IUD, they can take out the Nexplanon, and then you can start trying to get pregnant after that. So it's a really great option. And also they're safe for all women. So whether you have high activity lupus or whether you are high risk for blood clots, you can use IUDs and Nexplanon implants. So that's great. So you're not limited when it comes to this level of birth control. Now, our second level of birth control, on the right here, you'll see some X's and some check marks. So in each different column, you'll see that high activity of lupus, or if you have high risk of blood clots, there's some X's for you. And we'll go through each of these different types of birth control so that we can talk about the benefits and risks. This is the second level of effective birth control, meaning they're not as effective as IUDs or Nexplanon, but they're better than condoms, which we're going to talk about next. So Depo-Provera is an injection you can get in the clinic every 3 months. If you've been told that you have weakening of your bones, something called osteoporosis or osteopenia, you should probably avoid the Depo shots. And also if you're high risk for blood clots, it's another birth control that we like to avoid. NuvaRing is a vaginal ring that you can place yourself every 3 weeks. But again, clots or high activity lupus, we're going to avoid that. The estrogen patch is just like in the picture. You just place a patch on your skin. I believe you change it every week, and it has high levels of estrogen. So we recommend against this in women with lupus just because there's better alternatives, and it could increase your risk of having either flares or clots. And so we just like to advise women with lupus to try other types of birth control and try to avoid the patch. The mini pill is acceptable in any woman, even if you're high risk for clot or have very active lupus, because the mini pill just contains progesterone. It does not contain estrogen. So it is safe for you to use. Now, if you're on a medication called Cellcept, which is also known as mycophenolate, it's very important to know that oral birth control pills, or OCPs is another word we like to use, can interact with the Cellcept and make the birth control less effective. And that's really important because Cellcept is not safe in pregnancy. It's known as a teratogen, which means that it can affect the development of the child and lead to some disfigurement or difficulties with development. And women can actually have miscarriages with exposure to Cellcept. So I like to remind rheumatologists too that when a woman is taking Cellcept, we need to be on something other than oral birth control pills so that she doesn't have an accidental pregnancy, and then the fetus does not suffer from any type of disfigurement because of exposure to Cellcept. Now, this is the least effective group of birth control. It doesn't mean that they're bad. It just means that we don't want you using them on their own. They can be used in combination with other birth control options I've listed earlier. So if you are on the pill and you also want to decrease your chances of getting pregnant, why don't you combine the pill with condoms? And the great thing about barrier methods like condoms is that it's the only form of birth control that prevents the contraction of sexually transmitted infections. So birth control pills, IUDs, they will not prevent you from getting STIs, but a condom could. So that's where they come into being more beneficial, but as opposed to preventing pregnancy, condoms are not effective. And it's because people don't use them properly. People don't want to use them in the moment. And so inconsistent use of condoms is going to increase your chances of an unplanned pregnancy. Okay, so talking with your doctors about birth control. So something that we have recognized is that, and I'm sure you've experienced as well, doctors become uncomfortable when they talk about pregnancy in women with autoimmune diseases, including lupus. And it's because as rheumatologists, we don't get a lot of training on this. And so rheumatologists are uncomfortable and they go, oh, well, why don't you talk to your gynecologist? And so you go to your gynecologist and they go, well, why don't you talk to your rheumatologist? Or why don't you talk to your primary care doctor? You know, they'll probably know more about lupus and birth control. So all these doctors are uncomfortable. And so you kind of just get passed around to all these different doctors. And then you never get birth control. And then some women will have unplanned pregnancies or accidental pregnancies. And that's really frustrating. And so one of the tools I want to give you today is this handout we're working through. You can print it off of lupuspregnancy.org, and you can actually take it to each of your doctor's appointments and say, this is what my rheumatologist said. This is what my gynecologist said. We need to make a decision about what birth control I can be on because I'm sexually active and I don't want to get pregnant right now. So that's a trend that we've noticed amongst all these different specialists is everybody's kind of out of their comfort zone and they really need to talk to each other. So when we're making decisions about women, a lot of times we are in constant contact with their obstetrician or with their kidney doctor or their other subspecialists because communication is going to increase the chances that we make the best decision for your specific medical situation. So what if your birth control fails? And when I gave this talk previously, someone asked, well, what does that mean? What does birth control failing mean? It means if you forgot to take one of your oral birth control pills, or your condom broke during intercourse, or your IUD became dislodged. There's all these different definitions of what birth control failing means, but it just means that your plan A did not work and you notice a failure of that first mechanism. So now you have to move on to the appropriately named plan B. Plan B, which is an emergency contraception, is safe for all women. Women with lupus, women without lupus, women who have had blood clots before. It is literally safe for all women. And now you can buy Plan B over the counter. You can buy it on Amazon. I did a search this morning and it was $42, which was down about $5 from when I checked it back in May. So you can purchase this online. We like to tell women to have backup in your medicine cabinet. So if you have an unexpected birth control fail, you have an option right away. You typically will use Plan B within 3 days of birth control failure. But if you're out of that window, call your gynecologist and explain the situation, because they have emergency contraception that goes beyond the 3 days and maybe up to 5 days. So call them and talk about your options. It's really important for you to know that Plan B is not an abortion pill. That's a question we get asked very frequently. So Plan B prevents the egg and the sperm from uniting to create a fetus. It is not where you have a fertilized egg and then Plan B somehow destroys that egg and prevents the pregnancy. It just prevents the combination of the egg and sperm to even create a fetus. So if that's something that you were worried about or you had some type of conviction about, just know that Plan B is simply a birth control, the prevention of conception. It is not an abortion pill, and it is safe for all women to use, and you can buy it over the counter. You can buy it online, and I do believe you can get Prime shipping on this as well, and it will be shipped directly to your house pretty quickly. So additional resources, the American College of Gynecology, these are our sisters in pregnancy, where, Dr. Close, who's my mentor, we always like to say that we're the rheumatologists. So we're the experts in lupus, but your gynecologist and your obstetrician, they're the experts in pregnancy. So whenever it comes to a pregnancy decision that needs to be made, we're always working with them, but they're ultimately the experts on pregnancy. So we oftentimes will go to their guidelines and see what their recommendations are. And so here there's a few websites, bedsider.org and acog.org/patients will give you some additional resources when it comes to maybe some more questions that you have either about birth control or about pregnancy. Now, we're going to move on to the woman who is interested in pregnancy. And her question is, well, when should I get pregnant? And kind of the 50,000 foot view is that we want you to get pregnant when your lupus is well controlled on medications that are compatible with pregnancy. And the reason that's important is because if you have super high active lupus, and that's going to look different for everyone. So one woman's active lupus may be mouth ulcers and hair loss and rashes. Another woman's active lupus may be lupus nephritis, so inflammation of the kidneys. Another woman could have inflammation of the brain. What active lupus looks like is different for everybody. And so I can't give you a list of things that this is what active lupus looks like. Your rheumatologist or the provider who treats your lupus is going to know what active lupus looks like in your case. And we also have to get urine samples and we have to get blood samples and do a physical exam. There's so many different things that we have to do in order to determine how active your lupus is. But the overall goal is that your lupus is quiet. It is very well controlled before you get pregnant, and that your rheumatologist is aware of the fact that you want to get pregnant. And so they've either started you on medications that are compatible with pregnancy, or they've switched you off of medications that are harmful to pregnancy, and then started you on a regimen of medications that are safe in pregnancy. And sometimes that can take several months, up to 6 months, and sometimes up to a year, depending on if you flare after they switch your medications. So being in constant conversation with your rheumatologist about your family planning goals is great, because the sooner they know, the more they can prepare, and then you can get pregnant, hopefully on a relatively quick timeline. So this is what I was talking about before, is what does well-controlled look like? So typically minimal signs of inflammation. And like I was saying, is that inflammation in what organ? Is that lungs? Is that kidneys? Is that mouth or hair? Minimal urine protein. So typically when women come in and they're thinking about pregnancy, and then after they've gotten pregnant, we get a urine sample at each visit because we want to measure the amount of protein that's in each sample to see if there's a trend towards increasing protein. And that's because that could indicate inflammation in the kidneys. So we want to minimize the amount of protein in the urine as much as possible. Another sign that your lupus may be active is if you've required prednisone or any steroids over the last 6 months. So many people on this call have probably been on steroids before, and we love steroids as rheumatologists because they act quickly. So if you're having a flare of your lupus, we can give you steroids to calm it down quickly. But the reality is that we don't want you to be on lots of prednisone and steroids during pregnancy if we can avoid it. And so if you've been on and off of steroids over the past 6 months, then you may need to have different medications added to your regimen so that your lupus stays quiet and doesn't flare, causing you to require steroids on and off again. Other things we check for are certain antibodies. So some people on this call may be familiar with anti-Rho antibodies. A Rho is associated with something called Sjogren's disease, but our lupus patients very commonly will also be Rho positive. And the reason this is important is because Rho antibodies can cross the placenta where the baby's developing, and it can cause what we call neonatal lupus or lupus in the baby. And this will look different for different babies. A lot of them can develop like a rash after they're born, but the most serious side effect is that it can affect the electrical activity of the heart, and it can cause arrhythmias of the heart, or it causes the heart to beat abnormally. And in some cases, it can slow the heartbeat down. Now, that's very scary sounding, but the great news is that Plaquenil or hydroxychloroquine, which is a classic medication in lupus, is safe in pregnancy and reduces the chances of these heart abnormalities to less than 0.5 percentage point. Plaquenil is a very low risk medication, but with a very high benefit. So what we like to do is when a woman with lupus comes in, we like to look at her antibodies and say, are you Rho positive or Rho negative? And if you are Rho positive, let's start Plaquenil if you're not already on it, just to prevent the chances of neonatal lupus developing during your pregnancy. Another antibody that we look for, they're called antiphospholipid antibodies. And I've listed all 3 over here to the right. And typically we will test women for all 3 autoantibodies. And the reason this is important is because it can determine your risk of blood clots. And I've talked about blood clots a lot with the birth control options. You know, how high of a risk am I for clots? And if you have certain of these autoantibodies, your risk for clot can increase. So we like to check women for all 3 of these as well. And that can determine if blood thinners are needed at any time during the pregnancy. So let's talk about medications. And I've been saying pregnancy compatible, lactation compatible, and a good rule of thumb is that if a medication is compatible with pregnancy, it's more than likely compatible with breastfeeding. And we'll talk a little bit more about breastfeeding later. But this is a list of medications that we call the GO medications, which means they are safe in pregnancy. You can continue them in pregnancy. So Plaquenil is what I was just talking about for women who are anti-Rho positive, but honestly, most women with lupus are on Plaquenil. And so even if you're not Rho positive, you just have lupus in pregnancy, Plaquenil is a wonderful drug to continue. Chloroquine is a sister drug of hydroxychloroquine that we don't use as much in the United States, but it is an option. Azathioprine or Imuran, tacrolimus and prednisone, all these medications are safe in pregnancy. But like I said before, we really want to decrease the amount of prednisone that you're taking during pregnancy because it can lead to certain complications like high blood pressure or what we call gestational diabetes, which is diabetes during pregnancy. So we really like to maximize pregnancy safe immunosuppression and minimize steroids as much as possible during pregnancy. So if you get pregnant and you're taking one of these medications, you're going to simply continue taking them. That's great. Now, if you are on medications that are not pregnancy compatible, which we'll talk about on the next few slides, your rheumatologist will likely stop that medication that's not compatible with your pregnancy and start you on a medication on this list that is compatible with pregnancy. We often will recommend baby aspirin starting in the first trimester to prevent something called preeclampsia. Preeclampsia is a phenomenon typically after 20 weeks of pregnancy where women will get very high blood pressure. They'll start spilling a lot of protein into their urine, and it can cause complications in the pregnancy, and you might have to deliver early in order to stop the preeclampsia. It's not really known what causes preeclampsia. It's theorized that the placenta, which houses the baby, is not working properly, and therefore it causes all these changes in the body. And ultimately the baby has to be delivered and the placenta delivered as well in order to stop the complications that are occurring. But starting a baby aspirin during the first trimester or towards the end of it drastically reduces the chances of preeclampsia. So it's a very easy intervention. You take it once daily, and it really is beneficial. It has a very, very high benefit, and it's a very low risk medication. If you're taking any other medicines outside of your lupus medications, be sure to contact your obstetrician, because there's certain blood pressure medications that you may have to switch around. There's certain blood thinners that you may have to switch around. So it's very, very important that as soon as you become pregnant, if it's not a planned pregnancy and you haven't already had these conversations with your doctors, to contact them and say, these are my medications, what should I do? So these are the stop medications. These are medications that have data behind them that they are harmful to a developing fetus. And methotrexate and Cellcept are probably the two that we see a lot of in pregnancy, where women continue to take them and they have an unplanned pregnancy. And unfortunately, miscarriage is certainly an outcome that occurs with accidental exposure. But what we tell women is that if you are pregnant, unplanned, and you're taking these medicines, just stop them immediately and call your rheumatologist. Many of you should have like an emergency phone number that you can call the rheumatologist on call or get in contact with them. Hopefully within 24 hours, you can get in contact with your rheumatologist. And that's important because methotrexate and Cellcept, there's certain antidotes that you can take, like higher amounts of folic acid, in order to wash out that drug as much as possible to try to at least minimize the effect on the developing fetus. Cyclophosphamide is also known as Cytoxan. This is a really strong lupus drug that we use, and it can be teratogenic. It can definitely affect a child, especially in the first 2 trimesters. So it is avoided at all costs during pregnancy. Very, very rarely is it used in the 3rd trimester in life or organ threatening lupus, but that's kind of a last resort and really a situation that we try to avoid as much as possible. So if you are talking to your doctor and you're planning pregnancy, and let's say that you're on methotrexate, your doctor will say, okay, well, how about we start decreasing methotrexate and let's start azathioprine, which is on the go list here. Let's start azathioprine and let's slowly increase the azathioprine and slowly decrease the methotrexate. And let's see how your lupus does. Because in your specific situation, maybe your lupus will flare after they start the azathioprine. So we need 3 to 6 months to see how your lupus is going to respond as we're changing medications to prepare you for pregnancy. Plaquenil is recommended for all pregnancies. It's on the go list like we talked about before. If you're consistently taking more than 5 milligrams of prednisone a day, then you may want to talk to your rheumatologist about adding on additional medications in order to minimize or get you off of that little dose of prednisone. We've already extensively discussed starting aspirin and then any additional medications with your obstetrician. Now, there is this separate group called the yield group. And the thing about rheumatology is we're a very research heavy field, which is wonderful because there's a lot of doctors working to figure out a lot of questions that we have. But what's tough is that when a new drug is created, something like Benlysta is one of our newest FDA approved medications for lupus, we don't have a lot of data on pregnant women taking Benlysta because, we don't want to expose women to a drug and not know the consequences. Now, there are certain companies like Mother to Baby who collect data on accidental exposures in Benlysta, and we gather a lot of information from these accidental exposures. But if you're on Benlysta and this is an unplanned pregnancy, we're going to discuss ways to get you off of that Benlysta or belimumab and start you on other medications that we know for sure are safe in pregnancy. So you'll notice that this caution list, it just continues to grow because so many new drugs are being developed for lupus, which is wonderful, but we're going to need a lot of time in order to tease out what medications are safe for you to take. So who should be involved when you're talking about pregnancy? Definitely your rheumatologist. So I like to say the person who knows your lupus the best, the doctor who manages your lupus, which for most women is rheumatologist. For some women, it may be your nephrologist, your kidney doctor. So whoever's been managing your lupus for however long should be the person that you're talking to about pregnancy. And then that doctor is going to say, okay, I want to get obstetrics and gynecology involved. I want to get maternal fetal medicine involved, which have additional training in high risk pregnancy. But then if you happen to have other manifestations of your lupus, like I was saying earlier, that are so variable, maybe you have heart manifestations from your lupus. So maybe you have a cardiologist that you've worked with for a long time. They need to be involved in your pregnancy care, because there's going to be certain decisions that are made about your delivery process and anesthesia and all those things that all these specialists need to have a say in. So I would say that whatever doctors you see on a regular basis, let them know that you're thinking about getting pregnant. Or if you have an unplanned pregnancy, send them a message or contact them and say, hey, I just want to let you know that I'm pregnant. Do I need to adjust my medications? What changes do I need to make? What things do I need to be talking to my other doctors about? So this is a list. It's not comprehensive. You could certainly have other doctors involved during your pregnancy care. Now, what about other health issues? And we've touched on the majority of these during my previous slides, but if you have something called antiphospholipid syndrome, or APS, which is where you have a higher risk of blood clots, or you carry some of those autoantibodies that I talked about earlier, you may have to go on something called Lovenox, or low molecular weight heparin. And there's different dosing regimens based off of your previous history of blood clots, your risk of blood clots. So typically we work with blood doctors, hematologists, in order to decide about dosing for women. And a lot of women inject into their bellies. So actually that was a question I had when I started working in the pregnancy clinic, is if a pregnant woman can inject blood thinners into their belly, and they actually can continue to do that. Everybody should be taking a baby aspirin to prevent that preeclampsia. The anti-Ro antibody that we talked about, those women should be on Plaquenil, and your baby will undergo ultrasounds pretty frequently in order for them to look at the heart rate and the electrical conduction through the heart, like I talked about earlier. So you'll be having a lot of frequent screenings so that they can detect if there's anything wrong with the baby's heart, which can be associated with those anti-Ro antibodies. But remember, taking Plaquenil drastically reduces the chances of that happening. High blood pressure. There's a lot of medication options during pregnancy. A lot of women will develop, or women can develop, high blood pressure in pregnancy. Some women may have it before pregnancy. And so there's certain medications that are avoided because they're not safe for pregnancy, but obstetricians have a lot of medications in their back pocket in order to control your blood pressure. And that's really important over time. You're pregnant for 9 months, and so you don't want to have high blood pressure for several months. That can really affect your health. So we want to make sure that that's well controlled. And then pain during pregnancy. So Tylenol or acetaminophen is safe during pregnancy. A lot of women can take it if you're having joint pain or muscle pain from your lupus. NSAIDs, which are things like Motrin, ibuprofen, Advil, we like to minimize those during pregnancy. The FDA recommendation is that you stop them before 20 weeks of pregnancy, but I've actually seen a lot of specialists say, I would really like to minimize the amount of Aleve or ibuprofen that you take throughout the entire pregnancy, if possible. All right, breastfeeding. So I'm going to talk about breastfeeding in the context of if this is in your plan. If you want to breastfeed, great. If you don't want to breastfeed, that's also great. Whatever you want to do as the mother is fine. And so I'm just talking about breastfeeding here in the context of medications and if it's safe for you to breastfeed. And like I said before, if the medication is safe for pregnancy, it's going to be safe for breastfeeding. And some women, like I was talking to a woman yesterday who has vasculitis and who is pregnant. And during her pregnancy, she had to stop a certain medication for her vasculitis. And then she had a flare after she gave birth. And so she had to stop breastfeeding in order to start taking a medication to better control her vasculitis. And that's not an unusual situation that women can find themselves in. So just know that there are options. Babies who are formula fed it's a valid option if you have to start taking another medication that could be excreted into the breast milk and would make breastfeeding high risk for your infant. Just know that you're not alone in that decision, that a lot of women with autoimmune diseases kind of face that decision. It's a personal decision, and it's one that you should make after extensive discussions of risks and benefits with your doctors. So breastfeeding is recommended by the American College of Pediatrics. They recommend exclusive breastfeeding for 6 months and then supplemented breastfeeding for a year or longer. But again, we're really trying to normalize the idea that women can make the decision about breastfeeding for themselves. And some women will decide not to do that, and that is okay. And that formula feeding is okay. So we just are trying to really normalize that conversation with women after they give birth. So what if you have an unplanned pregnancy? So review the medications that I previously listed. So when you have that printout, it'll show you the go medications, the yield medications, and then the complete stop medications that are not safe. So let's say you're taking Cellcept and then you had a birth control failure and now you have an unplanned pregnancy. You're going to stop that Cellcept. Don't take any more doses of it. Try to contact your rheumatologist in the next 24 hours in order to let them know the situation. And like I said before, for certain medications, there are some antidotes that you can take to minimize the harm to the pregnancy. If you're taking a go medication, you're good. You can just keep taking your Plaquenil, call your doctor and say, hey, I had an unplanned pregnancy. I need to see you in clinic so we can discuss. And then if you're on a yield medication, remember that medication is like rituximab or Benlysta, just hold off on additional doses of those medicines until you've informed your prescribing doctor that you have an unplanned pregnancy. Start a prenatal vitamin. So rule of thumb is that if you're sexually active, you should probably be on a prenatal vitamin just in case you have an unplanned pregnancy. Prenatal vitamins are full of nutrients and vitamins that prevent any type of, or can prevent some deformities in babies. And what's tough is that sometimes women can go several weeks without knowing that they're pregnant. That's very normal. And the baby is forming, and maybe there's certain nutrients that it's not getting, and then it can lead to some defects. So that's why I tell women that if you're sexually active, take a prenatal vitamin just in case you're in that situation. But if you get pregnant and you're not taking one, just go buy a prenatal vitamin over the counter and it's a daily vitamin. Just start taking it as soon as possible. Make an appointment with your rheumatologist and your gynecologist, or if you already have a high-risk obstetrician, a maternal fetal medicine doctor, go ahead and make an appointment with them to talk about some of the risks and benefits and some additional decisions that you need to make, and try to do that as soon as possible. Mother to Baby is a resource I mentioned earlier, and they collect information on medication exposures during pregnancy, but they also give you advice, and this is their phone number right here. If you Google Mother to Baby, their website is wonderful, and there's a lot of different ways to contact them. I think they have a chat function on their website. They have an email, but you can also call them. And so if for some reason you can't get in contact with your rheumatologist or other specialists, this is another resource you can use in the interim. Now, infertility is not actually very common in lupus because of the lupus itself. Women with lupus typically have normal fertility. The issue is that because you have lupus, which is a lifelong disease, sometimes you'll have to delay pregnancy because you've been sick or because you're taking medications that are not compatible with pregnancy. And so the further you push out pregnancy, sometimes you get what's called advanced maternal age, which is really just beyond 35. It's really not old, but in the pregnancy world, it's considered old. And the ability to get pregnant may be a little bit more difficult because you've pushed off pregnancy for very, very understandable reasons. For women with lupus, there are what's called assisted reproductive technology options. That just means fertility treatment options. It's just called ART. And reproductive endocrinologists are the doctors who specialize in fertility treatments. We do recommend that your lupus, just like with pregnancy, is well controlled before you start undergoing procedures for fertility. If you were taking a medication like cyclophosphamide, we should avoid fertility treatments because cyclophosphamide is toxic to the ovaries. And so if you're trying to undergo fertility treatments where it's causing you to ovulate, that cyclophosphamide is going to be very damaging to those eggs that are being forced out from the fertility treatment. So we want to avoid fertility treatments while you're taking cyclophosphamide. And what you and your doctor can discuss is switching you to a regimen that is pregnancy safe, or at least not ovarian toxic. And then you can undergo fertility treatment. Not to get too into the weeds, but you can be on medications that are not pregnancy compatible, but still undergo fertility treatments if it's things like freezing your eggs, and if you're going to use a surrogate and not be pregnant yourself. But those are conversations to have with your rheumatologist and a reproductive endocrinologist. Now, if you have a history of blood clots or you have antiphospholipid syndrome, you may need to discuss starting blood thinners before undergoing certain hormonal therapies for fertility treatment. And last, we're going to talk about menopause. So women can develop hot flashes and night sweats. And hormone replacement therapy is something that can be offered to women. Doctors do try to minimize hormone replacement therapy as much as possible. But if your life is being impeded by all these terrible symptoms, there are some hormone replacement therapy options. But it's not recommended if you have a history of blood clots or stroke or heart disease. And so, as I've said ad nauseum during this talk, women with lupus can be high risk for blood clots, and especially women who have a history of blood clots or those with antiphospholipid syndrome. We're very, very concerned about hormone replacement therapy in that population, either causing exacerbation of your disease or making you higher risk for blood clots. Now, certain people, if you have quiet disease, you're low risk for blood clots, hormone replacement therapy can be considered, but again, that needs to be an extensive discussion. And then if you have autoantibodies for antiphospholipid syndrome, but you've never had actual blood clots, then that's another situation where you could consider hormone replacement therapy after talking to your doctors. All right, last section is COVID vaccination. So the bottom line is that women who are pregnant are higher risk from having poorer outcomes when they contract COVID. A lot of women here down in North Carolina that are pregnant, we've seen ventilated in the ICU because their COVID has been so severe. And obviously a sick mom is going to pose risks to the health of the pregnancy and the health of the fetus. So women with lupus who have an autoimmune disease, and many of you are on immunosuppressive medications, you're part of that special subset of the American population that we are recommending more doses of vaccines for, because your immune system, we are artificially suppressing it. And so for contracting COVID. And then if you're pregnant, you're higher risk for having poorer outcomes. So we're really just trying to avoid that situation as much as possible. COVID vaccinations do not cause issues with fertility. It's not going to affect your chances of getting pregnant. Please do not be afraid of that. There were data where they tracked periods off of smartphone apps, and it looked like the periods were a little bit delayed after the COVID vaccinations, but that was not significant. Those women did not have difficulty getting pregnant. They just had maybe some changes in their menstrual cycle, but it did not mean that they had fertility issues at all. If you are thinking about getting pregnant, if you are pregnant, if you're breastfeeding, you can get vaccinated. A lot of my friends are pregnant and they're medical professionals and they have all gotten vaccinated. We truly do believe in this cause of getting vaccinated. And the vaccination will also benefit your developing child as well. So we really, really caution women who are pregnant who haven't had a COVID vaccination or who haven't been boosted. We really, really encourage them to look at the data, and we recommend 2 vaccinations with mRNA vaccines, but then also 2 boosters after that. These are different organizations, they're expert panels who have recommended COVID vaccinations, the WHO, the ACR, which is our American College of Rheumatology, and then of course, the American College of Obstetrics and Gynecology. All 3 agree on vaccinations in women who are pregnant. So like I said before, 2 boosters and then 2 original vaccines. We are recommending Moderna or Pfizer just because the mRNA does seem to have a little bit more data, and you can mix and match mRNA vaccines. So you can mix and match Pfizer and Moderna as well. All right. And I think we have some time for questions.
Okay, we do have some questions. Someone asked, they were told that Plan B does not work, or at least is ineffective in people over 160 pounds.
That is true. That is great to see. So yes, unfortunately, Plan B is ineffective in women of a certain weight. So there is another birth control called L that we prescribe for women who are over that weight threshold of Plan B. So you can ask, I believe that's prescription only. So you can ask your doctors for emergency birth control called L. I think it's ELLE or ELE, and that can be used in women who are over that weight threshold.
I see that if prednisone is more than 5 milligrams needed, then add to the go list med. Does that mean if your daily dose of prednisone is under 5 milligrams, it's safe without removing it?
That's a great question. And the answer is that if there's a woman who is under 5 milligrams of prednisone, I wouldn't say that we would say, okay, you can't get pregnant, or, I think that under 5 milligrams, the risks of things that we're looking at, like high blood pressure, diabetes, are so low that we wouldn't say that you cannot get pregnant at that point. So what I would say is that, yeah, if you're below 5 milligrams, we may not have to add an additional medication in order to get you through that pregnancy.
I have polycystic ovarian syndrome and lupus, SLE. Is it common for women to have both?
That's a great question. I don't know the crossover between the two. I've seen hundreds of lupus women at this point, and multiple pregnancies, but I have not seen a lot of PCOS or polycystic ovarian syndrome in those women with lupus. So I have not observed a common crossover between the two, but I can't give you statistics specifically about that. I've done a lot of reading in the literature about women with lupus and pregnancy, and they do not cite PCOS as a common complication. So at least from what I've seen in the literature, it's not commonly reported in women with lupus.
What are your thoughts on Safnello with future pregnancy? I was informed it's a new drug with not much research yet, but assumed I should be off of it at least 6 months before trying to conceive.
Yeah, I agree 100%. Yeah, Safnello is one of those brand new drugs, and it often will take years for us to be comfortable. So just to give you perspective, rituximab is a drug that we've been using for a while in rheumatology, and we are just now becoming more comfortable using it towards the end of pregnancy as much as possible. But it will take years for them in order to feel comfortable with a new drug like Safnello. And I agree that being off of it for 6 months before trying to conceive is a good idea, because in that 6-month period, your doctors will likely start you on other medications in the interim in order to control your disease, so that you can have decreased risk of flare or complications during your pregnancy.
I assume that would be the same for lupus, which is also a new drug for lupus nephritis.
Yep, exactly. And there's, voclosporin, brand new coming out for lupus nephritis. All these new drugs, they're so wonderful. But nobody, obviously for good reason, nobody is doing clinical trials on pregnant women because that would be very high risk and unethical. And so it just takes time and honestly, accidental exposures, all these companies that collect information on accidental exposures, at least give us some insight into what happens with pregnancy exposure during, drug exposure during pregnancy. And so, yeah, I agree. Same thing. All these new drugs that are coming out, it's going to take several years.
Okay, we're almost out of time, so I'm going to just make this the last question. Do women with lupus have to be induced or get C-sections?
That's a great question. So women with autoimmune diseases have a higher risk of getting C-sections. There's a lot of different reasons for that. It could just be that doctors are less comfortable with their pregnancy, and so they have a lower threshold to just do a C-section or induce. With high-risk pregnancies, it depends on the complications, but a lot of times we will induce at 37 weeks in order to minimize risks that develop after 37 weeks, like preeclampsia or high blood pressure, HELLP syndrome. So I would say that many women do have induction of labor or early around 30. I say early, relatively early at 37 weeks, as opposed to letting you go to 40 weeks. And then C-sections are seen at a higher rate in lupus, but it's not guaranteed. So if you have a very quiet lupus and you're only on Plaquenil, it's very possible that you may not need induction or a C-section at all. So it's not guaranteed, but the short answer is that lupus patients who are pregnant have a higher rate of induction and C-sections.
Okay, we will make that the last question. I do want to thank you, Dr. Simmons, because I think this was very hopeful and very helpful. And like I said, we get lots of questions about this, concerns about you know, the young women hear they have lupus and then they hear you're not going to be able to have a baby, and that's just not true. And, you know, it's just, I hope all of you realize that it does take some planning. So hopefully, you know, you and your doctor can all work together. So this was very helpful. Thank you so much, Dr. Sims, for being with us today. We appreciate it.
Thank you.